I'm Harry to list my assessment of human performance, assignment 1, health screening, presentation. Health screening methods. There are 4 methods. These are the PARQ, the health history questionnaire, informed consent and health screening tests, which consist of 4 tests. It's important to do the health screening methods because they let the professional know if the individual who's come is prepared to do some exercise, and it gives them a history and flags up problems if they continue. The PARQ is a set of 7 questions, all yes or no answers, and they ask about risks of if exercise is done. They can, if yes is answered to any, the individual must be medically referred and they cannot continue with exercise as it could be, it's a risk to them. An advantage is that if all answers are answered no, then they can partake in exercise. But disadvantage is it doesn't take into consideration the history of the individual, like the family history, so they could have some underlying problems that have not been flagged off. Health history questionnaire is more in-depth than the PARQ. It asks personal lifestyle questions, family history questions, gives more of a history of the individual. So the advantage of this is if someone flags up joint problems, you can do exercise that maybe doesn't avoids joint a bit more. But yeah, so you can't, it's more precaution to avoid aggravating injuries, current injuries, and not aggravate any pains. Informed consent is a form that must be signed before any health screening tests are done, and it explains the procedures that they will be doing and outlines any risks for the individual. And yeah, as I said, you can't proceed with the health screening test if an informed consent isn't signed. A peak flow is one of the health screening tests. It is how quickly you can blow air out of your lungs. It involves a peak flow meter, and it involves the individual standing up in a comfortable place and blowing as hard as they can into a peak flow meter, and it can tell you if the airways are narrowed. An advantage is it's quick and easy, but a disadvantage is it can be, like, it depends on how it can be different with smokers and not get a proper result. And it does depend on the person's height and weight and age. And it can be repeated 3 times to get an accurate result. The waist to hip is a method for measuring body fat distribution. And it can also identify obesity, and if someone is obese, you can then know to do only light intensity exercise really, as they might not be able to, it might not be safe to do a higher intensity. It's carried out by measuring the waist to its narrowest and the hips, and normally if the waist is bigger than the hips, they are probably obese. And an advantage is there are only 2 measurements, so it's hard to get confused with it. It's fairly simple to do. A disadvantage though is that it could embarrass the individual if it is rather big. Blood pressure is to check the blood pressure and make sure it's not too high to do exercise or too low to do exercise. It's measured in systolic and diastolic, which is when the heart contracts and relaxes. And it should be taken, to get an accurate result, it should be taken twice, with breaks in between though. And the client must be rested for 5 minutes at least, so it is calm and, well, it's an accurate result, so it's not out of the ordinary. It must be either 60 to 80 diastolically and 90 to 120 systolically. And if it's 90 over 140, it's too high and should not continue. This is a machine test, so it might be a bit expensive to buy the machine, but it will most likely be accurate as it is a machine, so there's not human error. A resting heart rate is where you put your 2 fingers on your client's thumb and the wrist, but you don't use your thumb, as that can mess up the results as the thumb's got a pulse. It should be between 60 or 80 beats per minute, and if it's too low or too high, it's not right. You should seek medical referral or refer them medically and not continue. And what you do is you get the rate for 15 seconds and times it by 4 to get the full minute. I handed out 2 health history questionnaires. One person was 22 and a footballer, and one was a 24-year-old gymnast. The person A, the footballer, answered yes to one of the PARQ questions, so therefore would not continue any further and be medically referred before any continuation. Whereas person B was answered no, so could carry on the whole way. And we'll just carry on this form. Both answered yes to current medication, and therefore this must be looked at to make sure this does not affect anything they do whilst they do exercise. Also, person A answered yes to if they've been hospitalised recently, and he said he was going for an ECG soon. Therefore, he should not continue anyway, as he answered yes in the Park-E, but he would not. And be allowed to continue after that as well, as there's something that needs to be seen. But they also, on the family history questions, answered yes. One to a heart murmur and one to a blood disorder. Therefore, they could have an underlying problem that should not be aggravated, meaning they should only do light or medium intensity of exercise. We both do more exercise than the ACSM guidelines, with person A doing 10 hours a week and person B doing 20 hours a week. Person A was a footballer, so he had training and a game every week, so that is high intensity. And person B, having been a gymnast, he trains 20 hours a week to a medium and sometimes high intensity. But he has to stretch more, as it is gymnast and his muscles need to be tip top. So in all, just person A wouldn't have continued, as he did answer yes, and that is not. He shouldn't continue, it should be medically referred. And the books and the website I used.